Hey everyone, Leslie Cornwell, Midwifery Business Consultation. I get lots and lots of questions about I'm getting lots and lots of calls. When do I stop taking transfers? I'm having a hard enough time figuring out how to care for the women I have right now, but I just want women to have more choices and options. It breaks my heart hearing they're in the hospital and they want a home birth, or we have a birth center and we're already at our max capacity. So I need each practice to meet with their midwives, have a discussion, meet with the community midwives, and see what everybody is doing. If we can pull our resources together, we might be able to serve more women versus just focusing on our own practices. Know your delivery list. If you have a birth center, it's a little bit easier to stretch the limits. You still have to do postpartum visits and know the radius that you have to drive to do those. You could get creative and add some nurses or birth assistants that could do some of your home visits versus the midwives. But if you're a home birth practice, there is that balancing act of increasing the chances of women having an unassisted delivery. If you serve a large radius, you serve an hour, you serve a 2-hour radius, think of if you have 2 women that could potentially go at the same time on opposite ends of that. So every woman you add to your delivery list increases the chances by statistics that you're going to miss somebody's birth. So there's a balance. If we could predict the future, which is good with birth, we can't, but we still have to be aware that this is a business where there is a huge unpredictability of when the baby's going to come. So the advantages of a hospital and a birth center is even if they decide to come at the same time, you can jump rooms down the hallway and give amazing support versus a home birth. You have to have a good backup plan. If you're going to stretch your limits, you got to know that all your other midwives in the community are not stretching their limits and your ladies have a higher chance of not getting anybody, or having clear, honest discussions with your women. Hey, I'm considering adding some more ladies that really want a home birth. This is where I'm at for this month. What are your guys' thoughts? And that's part of your mission and your goal is you want women to have choices, but you also want the ones you're taking care of to get good, safe, quality care. So think about a lot with your birth center, your home birth practice, even your hospital practice. If you're starting to take transfers that maybe you're pushing your limits when you're already on the phone a bunch with questions from the current clients, how are you going to be able to take good care of the new ones coming on? So those are a lot to think about. Talk to your colleagues, talk to your community, get creative, start adding some midwife apprentices to your practice, start adding some support to your practice. If you're just solo doing your own thing, you've got a lot of opportunity to expand so you don't have to do everything. Get an office manager, get a birth assistant, a nurse that can join the team that can help you with some of these things so the midwife can focus on the births and the visits while this nurse can focus on the other aspects of the care to help you with. So lots and lots to think about in the upcoming weeks and months with COVID-19, but take good care of your women and serve them in a creative way.